Hello, this is Dean Brereton, and I have chosen to speak about the healthcare system in Japan. Before we get too far into it, I want to do just a little bit of an introduction to this presentation. First, in 1961, Japan was the first non-Western country to establish a universal healthcare system. Japan's system began first for manual laborers in 1922 as part of a management belief that maintaining a healthy, productive workforce would contribute to the nation's wealth and overall status in the world. Later, coverage was extended to the workers' dependents and the white-collar workers and so forth. Following World War II, Japan's new constitution made healthcare a right for all citizens. Today, it's a success story for all of the countries to look at, and all countries that are utilizing a universal healthcare system compare themselves usually to Japan's system. This presentation will offer an overview of the system's management. It will discuss some of the key health indicators specific to Japan. The process will be reviewed on how people gain access, what is the process like, and who provides the care. Lastly, there's a summary of good and bad, since every system both has its advantages and disadvantages. So let's begin. So this section will be the policies and how the system is managed. As I mentioned earlier, in 1922, the first plan covered labor workers in an effort to boost productivity and support a robust economy through a healthier labor force. If you remember your history, this is about the time where the world was nearing the end of the Industrial Revolution and treaties all over the world were being signed ending World War I. Developed countries around the world were taking a hard look at their health status and how healthcare was being delivered. In 1927, the first official employee health insurance plan was created. 1961, Japan, as part of the rebuilding itself post-World War II, created a universal healthcare system. Japan was the first Eastern country to do this. Japan has run its universal healthcare system in a similar fashion as many other European countries. Japan's system is mainly divided into three categories. These categories are the employees' health insurance, which is directed by health insurance associations, public servants' health insurance, which is directed by the central government with local associations, and then self-employed health insurance, also known as the national health insurance, which is directed by the government according to the type of employment. In addition to that, Japan has a type of system for the late-stage elderly over the age of 75 that's also run by the local government. There are a few others, but these are the main ones that the subcategories would fall underneath these three. The system is a little bit more complex than this organizational chart, but this is the basic structure of how it works. You can see how the government has different subsets that play into policy making and governance. Mainly, these governmental agencies set the prices and how the regulations will be actually put forth as far as care delivery and how the system will function. You have a second here, you can look it over and see all these different pieces and how they interrelate. Okay, funding. Health insurance expenditures in Japan are financed by payroll taxes paid by employers and the employee, and by income-based premiums paid by the self-employed. Now that's in contrast to the United States, where the federal, state, and local governments finance roughly 42.9% of all healthcare expenditures, and out-of-pocket payments contribute another 22%. Japan only uses 31.7% of all national healthcare expenditures that derive from the national and local public funds. Also, 12.2% come from out-of-pocket payments. Now, the largest share of healthcare financing in Japan is raised by means of compulsory premiums based on the individual subscribers, which is about 34.6%, and the employers, which is 21.7%. So if you're a non-mathematician like me, in simple terms, this means the patient assumes about 30% of the cost of healthcare, while the government then pays the remaining 70%. According to the Organization for Economic Cooperation and Development of Health Statistics in 2016, their database said that Japan's total healthcare spending accounted for 11.2% of its gross domestic product. This ranks them third in the organization, behind the United States and Switzerland for total healthcare costs. Virtually all medical care is provided under the National Uniform Fee Schedule. Now, uniform means that the same fee is paid by all insurers to providers, regardless of whether the service is performed in a tertiary hospital, a rural clinic, or by an experienced specialist, or even a recently qualified physician. Neither insurer nor provider have the freedom to negotiate individually on a different fee schedule. Now, to us Americans, we view this as being totally disconnected without any ability to have our opinion or voice towards our care. Consumers really don't have a choice in selecting their healthcare insurance plan either. They must join the plan, usually the one plan, offered by their employer, or if they're self-employed, that which is administered by their local government or trade association. Now, just like other places in the world, healthcare costs are going up in Japan. In the fiscal year 2014, patient payments made up 11.7% of all medical expenditures, which hit a record $40.8 trillion. Premiums paid by the insured and the employers made up 48.7%, and the rest, 38.8%, was funded by local and state tax revenues. This was according to Naoki Igami in 2014. Now, Japan, they've avoided the same type of political instability over healthcare as seen in the United States, thanks to tight, very tight government controls. For several decades, insurance coverage and prices have been set by the Central Social Insurance Medical Council. These are set up under the Health Ministry. If you remember back to that slide at the beginning, that organizational chart, they are a subset of the Health Ministry. Now, these are made up of mostly industry representatives, including the Japanese Medical Association, drug industry groups, and insurers associations. And these representatives review the prices for all medical procedures and drugs available in Japan every 2 years. Now, generally, this works to lower prices over time as much as possible. The government wants to then introduce a more yearly review from fiscal years starting in 2018 in order to help rein in some of these costs. The problem of this long-running system is that while the government controls the cost of medical goods and services, it does not control the volume of those services provided. This has fostered a culture in Japan of patients seeking more care than they really need because it's unlimited. There's no gatekeeper. There's no one that says, hey, you've met your quota, or there's no cost associated with it, or it's very low, so there's no inhibition in going to seek care. Now, I have some friends who happen to be from Japan, and they have this little story or a joke, so to speak, of two guys walk into a hospital waiting room. One says to the other, hey, where's Mr. Saito? And the other says to the first, well, he couldn't make it today because he's homesick. That's kind of a colloquial joke they have among themselves in reference to the gross overuse of their healthcare system. Now, this high demand serves the interests of the hospitals and clinics who need to increase the amount of services available or the volume to make up for that narrowing profit margin resulting from those government price cuts. This explains why doctors in Japan are already so busy, handling dozens of patients daily with very little time to talk with the patient and actually review their health with them. The appointments are very, very condensed so they can maximize every moment of their workday. It also explains why tests are so commonplace at the clinics and hospitals. Japan may need to reconsider its easy access to care with this aging population and more use. All right, so let's discuss some health statistics, or in other words, health indicators. Now, most of these statistics come from the World Health Organization, but I've gathered them from a few other locations as well. The graphics may be from other sources, but the displayed data has been verified by other sources, not only the ones listed on the graphic. Now, fertility rates, as you can see here, roughly just under 1.5 births per woman. I've compared Japan to the US here in infant mortality. Infant mortality rates are about 1% compared to, slightly higher than that, right around 5 or 6% in the United States. This graphic shows age and gender numbers are very similar as most of the West, with a slightly longer life expectancy. And then, as you will see on the next slide, ages are similar. Females have a consistently longer life expectancy than do the men. And if you've watched any YouTube videos, or maybe you've seen some of those there that give you maybe a reason why the males don't live quite as long, usually related to hobbies, stupid things that they do. So children under the age of 5 here are listed as the causes of death. Congenital defects account for 39%. Now, in the sources that I found, about 24% are miscellaneous other categories. 14% deaths were attributed to prematurity, 6% respiratory infections, 4% birth asphyxia, 2% neonatal sepsis, and 2% diarrhea. Now, again, I'm not a mathematician, but that doesn't add up to 100%. So there are some other things out there that are not listed when I gathered the data. So people over the age of 5, this is numbers in the thousands, and this is the top causes of death. I found it a little bit interesting that respiratory infection was the #1 cause of death in Japan, followed by stroke, cardiovascular disease, and then pulmonary system cancers. Now that's everything from trachea to lung and everything in between. They broke down different types of cancer. If you look at different statistics, cancer is higher on the list if you put cancer as a group in itself. But I wanted to bring it down just to show the different cancers because they listed them out as separate. 51,000 stomach cancer, and colorectal was next, and liver cancer, unlike compared to the U.S., where lung cancer is the #1 killer. So here are some other noteworthy health indicators. Self-harm accounts for about 2.5% of all deaths in Japan. Children that are immunized, and it didn't list the age by which they're immunized, but I'm guessing it's similar to us, around age 2, is at around 98%. 6% of adults are considered obese, and adults with hypertension is gradually increasing, however, still lower than other developed countries, where 26.4% of males and 16.7% of females had a systolic blood pressure of over 110. Again, much different than the US. So let's talk now about who is providing care for the citizens and population of Japan. Most areas, the services are provided through regional or national public hospitals or through a private hospital or clinic. Patients have universal access to any facility through the hospitals, and they tend to charge more at the hospital than at the clinic, especially if you don't have a referral. So you can imagine that most care is provided in an outpatient type clinic, and these usually include a team of a physician and a few nurses. The most recent statistic I could find is in 2014, where they had 6.8 full-time equivalent workers, 1.3 physicians. I don't know where they got the third of a physician, but 2 nurses and a couple of clerks. And also interesting to note that in the clinics, they can actually dispense medications like a pharmacy. So now, access to care. As mentioned before, everyone has health insurance. So basically, everyone has an unobstructed access to the care. Costs in Japan are lower compared to those in other developed countries, and utilization rates are very high, much higher than others. Japanese patients, like those in the US, favor medical technology like CT scans and MRIs. They receive MRIs at a rate 8 times higher per capita than the British and 2 times higher than the Americans. Japan has about 3 times as many hospitals per capita than the US, and on average, Japanese people visit the hospital more than 4 times as often as the average American. Due to large numbers of people visiting the hospitals for relatively minor problems, a shortage of medical resources can be an issue in some regions, particularly the heavily populated ones, even more specifically in the city of Tokyo. And now that will be covered a little bit later in the Systems Challenge section. Now, as mentioned earlier, public health insurance costs cover most citizens and their residents, and the system pays about 70% of the medical costs, including prescription drugs, with the remainder, or like I mentioned before, about 30% covered by the patients. There are some capped premiums that may apply depending on the specific plan. The monthly insurance premium is paid per household and scaled to annual income. Supplementary private health insurance is available only to cover the co-payments or non-covered costs, and usually makes a fixed payment per days in the hospital or per surgery or per procedure rather than the total expenditure. Now, the great thing is, like I mentioned earlier, everyone is covered by some sort of plan. Every person who lives in Japan fits into some category, whether they're employed by a specific industry, or they're not working because they're retired, or they're even in the indigent homeless population. Everyone gets covered. Okay, so what are the advantages of this universal healthcare system? All right, the biggest advantage, like I mentioned just a while ago, everyone's covered. Coverage is totally universal. Costs are controlled by the government. Now, again, I mentioned that universal or uniform fee schedule. This has very, very specific limits on what can be charged for certain procedures or services rendered, and this is reviewed every couple of years. However, they're currently reviewing a policy shift to doing that every year. Patients have the freedom of choice to choose where they want to go. Wherever they are, they can walk into any place, any facility, and get health care for whatever problem they may have. And according to the source, they say there's no waiting involved. However, as I mentioned, cities like Tokyo, who have this huge influx of patients in peak times, there's a wait. I mean, no one can really think that they're just going to be able to waltz into a healthcare situation and just walk in and get treated no matter what their problem is, because they're still going to have some sort of process of triaging the need based on acuity. Each physician is paid the same, regardless of what procedure is done. There's that fee schedule, and if some doctor puts in a stitch, it doesn't matter if that doctor is brand new out of school or the most prestigious plastic surgeon, they all get paid the exact same. Prescription and dental costs are all covered within this health system. So every aspect of healthcare needs are all somehow covered under the universal care system. All right, so it's so great, but are there some hang-ups? And there are. Coverage excludes preventative healthcare exams and normal deliveries, although some preventative healthcare measures are now being added into screening categories that are covered, and most people are given the ability to have a once a year well visit or a physical of sorts, and medical exams for all pregnant women, infants, and young children are totally free and unlimited, regardless of why they come in. Financial incentives encourage this excess use of testing and equipment and radiology procedures, even prescription drugs. There are more prescriptions given per capita in Japan than almost every other place in the world. They have really long hospital stays. 40 on average is the number of days in the hospital. And this is partly due to a lack of outpatient or long-term care type facilities. Like we have nursing homes for the chronically ill elderly people. There they just stay in the acute setting or in the hospital, and that's where they're given all their care. Medical services are fragmented, and in the absence of expenditure controls, both clinics and hospitals suffer from a significant duplication process of services and procedures that are done. There's not a great deal of communication, so oftentimes these expensive tests are repeated if the person doesn't go to the same place. Again, they don't communicate well together, so what ends up happening is the same tests are done over and over again because they don't talk to one another. Another downside of this long-running system, like I mentioned before, is there's no real governance of use. There's strict government control of the goods and services according to their costs, but nothing controls the volume of those services provided. And so, again, this has just created this culture of go get healthcare for whatever is wrong with you rather than try to fix it yourself or do anything on your own. They just go to the doctor, and that's just racking up not only the costs, but it's causing a backlog of patients who are in the system trying to get care all at the same time. This is getting more complicated as the population ages, and they actually do have more legitimate chronic problems that they're going to their healthcare providers for treatment. Now again, this is leading to this bottleneck or backlog, especially in the very urban areas where doctors are so busy they just cannot see all of these people that are seeking care in a timely manner, and because of their education system, it's pretty good. But another problem is that these particularly family practice type physicians in Japan, they're not really adequately trained on detecting illnesses, especially the more complicated ones. Now, again, there's no real incentive to become a specialist, so you have a lot of general practice providers who are trying to function as a specialist, and they become so dependent on testing and all those things, it slows down the process, and gradually it's increasing the cost as well. Some doctors may claim, for example, that they're an internal medicine doctor, but they really have no formal training or specialized education in that, so they aren't providing as maybe a higher quality care as maybe they should be able to do. And again, this is a problem with their reimbursement. Now, according to Inouye, staff shortages are also a big problem, mainly because of this high volume of patients. He mentioned that for every procedure, it's faced with a shortage of practicing physicians compared to others in the same category of systems. There's a shortage of about 3 physicians for every 1,000 people. There are 3 physicians short, and nurses are in the same situation. They're down about 8.4 nurses per 1,000. And so, again, as more people are coming into the system seeking care, there are fewer healthcare professionals able to provide that care. Facts are facts, and statistics, well, they don't usually lie. Japan has the world's healthiest people. In general, there is less of a percentage of people who are sick with chronic illnesses and a higher number of life expectancy when compared to the United States, for example. The Japanese live a better lifestyle than most Americans, which plays a pretty big role as to why they're healthier. But part of that reason also is the fact that they have complete access, unrestricted to healthcare, regardless of their socioeconomic status or really any other reason. Now, we can't perfectly compare a national healthcare system to each other, nor can we wholly adopt others. But Japan's system, for example, is bolstered by low levels of violence, low levels of drug addiction, low obesity, and health income disparities, which are rampant in the United States. Japan's emphasis on preventative medicine, though, is partly responsible for producing one of the healthiest populations on Earth, with a life expectancy of over 4 years greater than that of the United States. Japan has enjoyed this wonderful success. They may have, however, need to step back from the current all-you-can-eat type system, where there's a lot of waste, and they need to brace for more patients in the upcoming years that will have more complicated health issues with less money on hand. Hopefully, they'll be able to make those adjustments and continue the system that they have that's worked so well for them for so long. And we'll have to sit back in our own country and compare ourselves to them from a distance. But I think there are a lot of things that can be examined, possibly translated into our healthcare system, use what they have that works, and maybe take a lesson from them. I think that our system could certainly benefit from examining some of their healthcare practices and how they've done what they've done over the last few years. Lastly, these are the references. As you can see, I've tried to keep things mostly current, and this is where I got the information for the presentation. I appreciate the opportunity to investigate and look at the healthcare system of Japan and your attention throughout this presentation.